I helped create, and it should be hopefully added soon. This is a sandbox server, doesn't have anything on it, but a couple patients were added. One has one visit, an ophthalmology visit. One has more than one. That's important because we do pull old data forward. Let's look at this first patient, and this is the guts of the eye exam, and it opens up with all of your predetermined preferences. As you work on the form, adding patient data, the iMag form learns what your preferences are. Although there is a settings area here, it's empty, there's nothing there yet. I may remove it. It's there because, well, it looks good, and there may be settings that have to be added in there that you want to override settings that you choose. I'll explain that later, but let's look first at the vision. Here is the main guts of the vision engine. We have different windows that can open. We have your current glasses. This is the prescription. Manifest refraction is here, along with auto refraction, cycloplegic refraction. That's your wet refraction. How was it done? Was it manual? What drugs did you use? And contact lenses. This database has to be built right now. There's only a couple in there, and the different suppliers that are there, and the different lenses. I don't do contact lenses, so I don't look at that, but we'll update that with lists that anybody needs, and they're fairly standard across the world, so that should be easy. There's some additional data points that show here: pinhole, pan, brightness acuity, keratometry readings, IOL calculations. This is a summary page or a summary block for all the visual acuities if you want to hide everything. And just look at, well, these two are linked together, but just look at visual acuities. You can do that. Pinhole, that should be a 20. When you change it here, it will automatically change here. Let's tab, and it changes because they're linked. Notice this turns blue. Anytime a value is manually changed, it turns blue, and via Ajax it's sent to the server and automatically stored. There's no save button if you notice anywhere on this page. There's no save at all. Everything is saved automatically. So let's default to text view for the introduction. If you don't want to look at any of those, the visual acuity things or refractions, you can just hide them, make the page easier to view. You can look at them right here. These are the different acuities. Anytime something is changed in one of these fields, so this is auto refraction for the right eye, so that's 20/50 minus. And now it's saved. When we go and look for auto refraction, that's under the MR auto refraction here. Notice that the acuity was changed in that spot. We note down here, auto refraction is changed here as well. They're all linked. Fine. Tension, you can adjust the time, but this is automatically adjusted for when the form is opened. This is straightforward, right eye, left eye, applanation, tonal pen, finger tension. This will lead to a graph, and you can display IOPs over time. I noticed that in one of the other forms in openEMR track anything. This is a perfect use for that. We'll just have one of these little squares that pop up down here will be, tension over time. Nice little feature. Amso grid, simple click, 5 different points, or if you think it's normal, blank them all out. Confrontational visual fields, fingers, count fingers, fine. Pupil reaction. What size is it? How far does it go down? How reactive out of +4? And is there an apparent defect? And then if there is some problem with the pupils, maybe you need some dim illumination for 80s or Horners, and you could write in here if you used, Pilo 0.1% failed to dilate, what have you. Notice again it turns blue, goes from the tan, which is ready to take new information. If you touch it but don't change it, it doesn't turn blue. stays yellow. So you did touch that, but you didn't change the value that was there. This one was blue, is sent to the server. If we refresh this frame, let's reload this frame. Notice that this will change to the default. It's no longer blue because you went and refreshed it from the server. All right, let's stop here, and we'll go on in the next segment to the actual exam.